The Ibadan Electricity Distribution Company has agreed to reconnect the University College Hospital to the power grid after months of blackout. This resolution was announced by the Managing Director of the IBEDC, Francis Agoha, after a closed-door meeting with the management of UCH. Senior reporter Olaido Yewale has more.
For nearly 4 months, the University College Hospital in Ibadan has been plunged into total darkness, significantly hindering its ability to provide quality medical care for patients. The crisis stemmed from an outstanding debt of approximately 500 million owed by the hospital, sparking widespread concern and criticism from patients, medical students, and other stakeholders affected by the prolonged power outage. Public outcry intensified after reports emerged that patients were forced to bring generators to the hospital to access electricity. Although the UCH denied these claims, stating that alternative power sources were in use, the situation prompted intervention from the Minister of Power. Following a crucial closed-door meeting, IBEDC agreed to restore electricity to the hospital within 24 to 48 hours.
We're open to connect the hospital within the next between 24 to 48 hours. And there are conditions precedent we have agreed with the management that we have to do. We have to be able to know that the energy going in is well accounted for. We don't want to just connect and then we're unable to chase money for the energy. So
IBEDC key agreements reached include immediate implementation of an installment-based repayment plan for the outstanding debts over 8 to 12 months, individual responsibility for electricity bills by each institution and resident within UCH, collaborative efforts between UCH and IBEDC to combat power theft and conduct an energy audit.
We have the budget to do this.
The Minister of Power also announced a plan to integrate UCH into a special project designed to provide a dedicated power supply to the hospital.
So in terms of stability of power supply and intervening to reduce the energy costs on the hospital, which I mentioned as installation of interconnected mini-grid for the hospital. The process is starting immediately.
Though the minister's visit is aimed at resolving the crisis, he also encountered protesting medical students outside the hospital. The demonstrations were suspended after assurances were given regarding the latest resolution.
The University College Hospital feel for you the prayers and the agonies of going through darkness. Nobody ever finds that kind of thing easy.
The intervention of the Minister of Power, coupled with the compromise reached by both parties, it is expected that this will bring a lasting solution to the power crisis at UCH and prevent it from reoccurring in future. Olaido Yewale, TVC News, Ibadan.
Let's bring in Olaide, who joins me live from Ibadan for more updates on this development. That promise was between 24 and 48 hours. Can you tell if the power at the hospital has now been restored?
So, Nitfemi, as I speak, the power is yet to be restored. And we hope that between today and tomorrow, power will be fully reconnected to the hospital. But reconnecting the lights or power is not actually the real thing now. The real thing is the federal government implementing the long-term solutions that were proffered yesterday while in the meeting with the both parties. And one of them is energizing education program that is trying to connect the school and the hospital with a mini grid, which will give them a lasting power solution. That is, the grid is going to, if you can hear me, the grid is going to be serving the university and other institutions around it. And then another solution is, you see, the other institutions like the banks and other residents in the school. If you can hear me, Nifemi.
Indeed, I can. There are genuine concerns about how solid this agreement it really is, the one reached between IBEDC and UCH, especially considering that part of it are concerns about auditing energy and making individuals responsible for the energy they consume.
So, Nifemi, this is part of the long-term solutions that we spoke about because yesterday the IBEDC and UCH they agreed that there was going to be a collaboration between both parties to audit the power to audit power in the institution in the hospital, and then once this auditing is done, they will be able to detect those who are what engaging in power theft and those who are sabotaging the process. So these are part of the long-term solutions that will ensure that this latest development is a long-lasting one. And then one of the problems and issues that was raised yesterday is that there are other institutions at the hospital that are engaging in that are also using the power and making it and making the power compile that is giving them that much debt that they are owing. So another solution is that these institutions will not be responsible for paying their own power bills, and it will not be just UCH paying for the old bills. Another one is, the College of Medicine is also situated at UCH, and students will be using gadgets and all other things like boiling ring, which will lead to accumulated debt and accumulated use of power. And this is part of the reasons why why UCH still has this huge bill to foot. So by the time the power grid is connected to all of these sections, they are going to monitor how power is being used at the university, at the institution, that is the hospital, and also the College of Medicine and other institutions. Nifemi.
Olaide, just how satisfied are all the critical stakeholders, especially the students who protested yesterday when they saw the minister?
Okay, yesterday, some of those students who came to protest were raging. And then when the power minister gave them the analysis of what actually happened and how they are going to sort the situation, they became so calm, and with the hope that power will be restored. So, and one of the things he said was that he cannot be looking at the institution, a premier institution like that, with suffering like this. And then he said that all other the solutions that were proposed to other teaching hospitals in Nigeria is the same solution that will be proposed to this one too at UCH, and which is what the connection of the interconnected mini grid that will be connected in the various sections of the university. He said so far this project has recorded success in other institutions across the country, and it is going to be implemented now at UCH, and it is hoped that this is going to bring a long-lasting solution to the power challenge in UCH.
We're counting on all the stakeholders matching words with action, and we'll follow up with just how power will be restored in the meantime. Olaide Oyewole live for us in Ibadan.